Hello again. Thank you for watching. Thank you for listening. Dr. Wright, according to the University of Michigan. I work at the Tahoma Clinic in Tukwila, Washington, where we work with natural substance and natural energy to help prevent and treat disease. All right, well, today is going to be about cataracts. Yes, there is something we can do that sometimes, and notice I said sometimes, I didn't say every time, will stop the progression of cataracts. And sometimes we can even get them reversed if we catch them early enough. I'm not kidding. They can be reversed. There actually are double-blind, I know that's a bad pun if you're talking about your vision, there actually are double-blind studies that include a result of reversing early cataracts. No kidding. But first, let's get to the cause of them. One of the big causes happens to be the tendency to type 2 diabetes. If you've been told you have an early cataract, please get yourself checked with what's called the Kraft test, K-R-A-F-T test, for prediabetes. If you want to know about that test, go to meridianvalleylab.com, meridianvalleylab.com. And on their website, you click over here and you read about the Kraft test. It's something your doctor can help you with. If we have a tendency to type 2 diabetes, we have a greater tendency to cataract. Another thing that helps to lead to cataracts happens to be, lactose, milk sugar. So you want to be staying away from that too. There's both the sucrose, the fructose, and the lactose. All those oses can lead to cataracts. And there's certainly other things too, but those are the major ones. Now, what are the things we can do if we've been told we have an early cataract? And please ask your ophthalmologist when you see your eye doctor, or your optometrist when you see your eye doctor, do I have an early cataract? Because very well-meaning, well-intentioned ophthalmologists have told me, I don't tell them if they have an early cataract, they just worry. And all we can do about it is surgery anyway, so I don't necessarily tell them. So you'll have to ask. But let's say you've asked or you didn't and you were told you have an early cataract, then what can you do? Now here comes something that I think is sort of fun as well as serious. It's from a letter to the editor of the Texas Medical Journal by an ophthalmologist who had a good sense of humor as well as being willing to spread information. He wrote, I want to warn my fellow eye doctors that since I started having everyone who has a cataract take 40 to 50,000 units of vitamin A every day, my income from cataract surgery has gone down by 2/3. I thought that was a really cute way of putting it, but he was doing much less cataract surgery if he had people take vitamin A 40 to 50,000 units a day. And don't ever do that if you might get pregnant, because it can hurt the fetus. But other than that, that is a safe dose of vitamin A. And you'd heard from me before that vitamin A does many other things around the body too, just like all the nutrients do. So that's one thing we can do. Now there's another thing we can do. There's a study on a botanical called bilberry, B-I-L-B-E-R-R-Y. And what it tells us is that we can prevent cataract formation with bilberry, and we can prevent cataract progression with bilberry. And you can find that in your local natural food store, Tahoma Clinic Dispensary, compounding pharmacy. Yep, they all have the bilberry there. And it's European blueberry, so we're unlikely to hurt ourselves with an extract of European blueberries. But possibly the biggest deal is a development that first came out of Russia by a doctor with a very long Russian last name, which I can't pronounce, but a couple of double-blind studies. It's an eye drop. It's an eye drop of something called N-acetylcarnosine, not carnitine, but N-acetylcarnosine. Now, this is sold in the natural food stores at the Tahoma Clinic Dispensary, the compounding pharmacies, as CAN-C, C-A-N-C. And of course, they're not allowed by law to put on the label that double-blind studies have shown that it helps to reverse some early cataract. They're not allowed to put that by law on the label because, you see, it's an unpatentable molecule, and since it's natural, totally natural, can't hurt a thing. CAN-C eye drops are sold in all the places I mentioned to you, and one puts one drop in actually both eyes. Well, what if I only have a cataract on this side? Well, you're more likely to get it on that side, aren't you? So you might as well use both sides. But if you don't want to, put it in the eye that has a cataract, and you do that twice a day, kind of indefinitely, the earlier the cataract, the more likely it is it'll go away. And yes, people have come and told me, well, I was told I had an early to mid cataract and I put those drops in and it just progressed anyway, even though I put in the eye drops. And I'm sorry, but that does happen sometimes. But there also have been a substantial number of people who've come in and said, hey, my cataract stopped progressing. It just stayed where it is. If I keep using this, I might not have to have surgery. And when I told the eye doctor about it, he didn't believe it. I hear that a lot too. And there have been people who've told me that their cataracts have regressed and even disappeared. I can't give you percentages on this one. I can tell you that the material is safe, this eye drop. It's worth trying. And the bilberry is safe and worth trying. And if you're worried about the vitamin A being a high dose for you at 40 to 50,000 units a day, please check with a doctor skilled and knowledgeable in natural medicine. And that's that. And thank you very much for listening and watching.